These people are scumbags. No other way around it. No other way around it. No other way around it. This infuriates me to no extent, and I have a personal animosity towards these people to begin with. Oh my goodness. So Lynn sends this to me, and she writes in, hey Josh, there are a lot of people losing everything to medical bankruptcies. I'm referring to your video dated June 27th, 2019. Lynn lives in Charlottesville, Virginia, and she's appalled by what UVA is doing. Maybe medical bankruptcy is only 4%, as you stated in your video, but what's happening here is extremely distressing. Yeah, these things aren't mutually exclusive, Lynn. They aren't mutually exclusive. Yes, there are a lot of people losing everything to medical bankruptcies. They're not the majority of the population in medical bankruptcies, but it still happens, and it still friggin' pisses me off because it's wrong in every stretch of the imagination. Infuriating. But you can't mix the two, and that's the drawback. You can't sit there and say, oh, medical bankruptcies cause the majority of medical issues because the majority of bankruptcies. It doesn't mean that there aren't people losing everything, and it doesn't mean I don't have sympathy for the people who are going through what UVA is doing to these poor folks. It's infuriating. Absolutely. But you can't fall for the fraud that Elizabeth Warren and her band of merry freaking tyrants are going to save you from this. Anyway, so let's talk about this. I want to share with you my story before I dive into this, because this, I'm telling you, man, these freaking hospitals. Oh, so let's start with a premise. Michelle Obama, everyone's favorite woman. Yeah, she was a director somehow for freaking the hospital in Illinois in Chicago once Barack Obama got elected to state senate. Did Michelle Obama have any hospital expertise? No. They gave her a fat, cushy job for $300,000 once Obama was elected to the state senate. Now, she didn't do anything. It was totally just a job in name only. We call that a gyno, I guess. Freaking nuts. Because it's all political. All these hospitals are political based. All right, so let me tell you part two of this. And when I saw that with Michelle Obama, because I think he got elected in 2004, man, it set me off because I said, wait a second. I know this happened in my own world. So we had UVA. Chloe, my second, had spent a month of her life at the University of Virginia NICU, the neonatal intensive care unit, because she had what's called ventricular tachycardia. Very, very rare. Ventricular. They initially thought it was SVT, which is above the heart. It is ventricular. Like, I can't remember the whole issue, but when I tell docs that she had ventricular tachycardia, they all look like, huh? I don't know. They all think of this like, I don't know what I'm talking about. But she did. She had not SVT, but it's just ventricular tachycardia. So the first month of her life, she spent at the UVA neonatal intensive care unit at the UVA Health system. All right, lo and behold, we're getting bills, thousands and thousands and thousands of dollars. You know what I'm saying? And insurance paid a good amount of it. So God bless private health insurance for sure. They paid a good amount. The nurses, one was a guy, and I forgot his name, but he was just a good guy. He said Chloe was his favorite. I'm sure he says it all to all the ladies at the NICU, but man, he's just a good guy. And just a wonderful man. And there are just some great people in there too. But I'll never forget the first lady who was a nurse that we saw was, you could just see the fear in her eyes at Chloe because she had never met a baby with ventricular tachycardia. You could just see she was, all right, hold on just a second. Let me pause this and manage my discus full space. When Chloe was at the UVA NICU, you could just see the fear of this lady's eyes because she's dealing with a lot of preemies and a lot of crack addicted young babies too, and they were used to that, but not a big girl. Chloe was the biggest girl on the block because she was not a premature baby. And she wasn't born to a mom who's had crack addictions. The whole thing is just sad. It's horrifically sad. No other way around that. Anyway, long story short, I was pretty active in the Chamber of Commerce in Virginia, my local Chamber of Commerce, not the corporate Tom Donahue corporatist Chamber of Commerce. And I got to know local politicians and whatnot. And I got to talk to a guy who's a local politician, and he also had a child at the NICU. And he also had major medical bills. All right, so you got old Josh, poor boy, all right? You got this politician who himself was not all that wealthy either, but he was a politician. He knew people in the field, and he was aligned politically with the powers that be. They waived all his fees. They just said they wrote it off. Didn't write mine off. And we actually volunteered quite a bit, my wife and I, for golf charity courses. I talked to a couple of business owners that had kids down there who would do all these fundraisings for NICU and stuff. And I remember reading this. I talked to this guy. He was a good guy. Well, he was an okay guy, but I remember, he was politically ambitious. And I just remember talking to him at the same time I was reading about Michelle Obama getting hired by the hospital in Chicago. I said, it just like a brick, man. It hit me like a 2x4 across the back of my head. I said, this whole thing is corrupt. I said, why is Michelle Obama getting $300,000? Why is this politician on the Republican Party too? He wasn't a Democrat, he was a Republican, getting his fees waived, and I'm not. I'll never forget that. I said, there's something. It's all political. It's all political. These hospitals are political. Anyway, so then Lynn sends me this. UVA sues thousands of patients seizing paychecks and putting liens on homes. And his dateline September 9th, 2019. And, every now and again, the mainstream media does good work. Unfortunately, not very often anymore. But let's read this. And this is going to infuriate you, as rightly it should. Heather Waldron and John Hawley are losing their 4-bedroom house in the hills above Blacksburg. A teenage daughter, one of their 5 children, sold her clothes for spending money. They worried about paying the electric bill. Financial disaster, they say, contributed to their divorce finalized in April. Their money problems began when the UVA Health system pursued the couple with a lawsuit and a lien on their home to recoup $164,000 in charges for Waldron's emergency surgery in 2017. The family has lots of company. Over 6 years ending in June 2018, the health system and its doctors sued former patients more than 36,000 times for over $106 million, seizing wages and bank accounts, putting liens on homes, on property, and forcing families into bankruptcy. Unpaid medical bills are a leading cause of personal debt and bankruptcy. Well, I like how they at least add the caveat personal debt as opposed to solely bankruptcy. With hospitals from Memphis to Baltimore criticized for the role in pushing families over the financial edge. But the UVA Health system stands out for the scope of its collection efforts and how persistently it goes after payment, pursuing poor as well as middle-class patients for almost all their worth. The health system sued patients for as little as $13.91 and as much as $1 million during most of that period until June 2017, when it restricted lawsuits to those owing more than $1,000. Wow, you're restricting lawsuits to those owing over $1,000. Every year, the health system sued 100 of its own employees who also happen to be patients. You freaking scumbags! You freaking scumbags! It garners thousands of paychecks, largely from workers at lower-paid employers such as Walmart, where the university took wages more than 800 times. Under a Virginia program designed to help state and local governments collect debt, it also seized $22 million in state tax refunds to patients with outstanding medical bills in the last 6 years. Most of it without court judgments. Over many years, it filed thousands of property liens from Albemarle County all the way to Georgia. Beyond its recovery of debts, the university demanded some former patients pay an additional 15% for legal costs plus 6% interest on their own. The health system has the most restrictive eligibility guidelines for financial assistance to patients of any major hospital system in Virginia. Savings of only $4,000 in a retirement account can disqualify a family from aid, even if his income is barely above poverty level. How did this guy, the politician, get it? It's all political favoritism. And so the problem here, all these people like my friend Lynn here, she's going to advocate for bigger government. Bigger government just means more political favoritism, which means more people who are politically connected, Michelle Obama or this guy from the Republican Party, are going to get favors directed towards them. And you and I in the middle and lower middle class are going to get screwed because we don't have the political favoritism. Big government means this stuff, my friends, always and everywhere. It always is favoritism. And you, my friend, don't have the political chops to get the benefit of that. The hospital ranked #1 in Virginia by U.S. News and World Report as a taxpayer-supported and state-funded, not a company with profit motives. Aha! Because they always say for-profits. They're always saying for-profit universities are bad. We got to regulate them out of business, but it's the non-for-profit that are great. That freaking ignorance of people, man. They're not-for-profit. That means they're holier than thou, but the for-profit ones are not. The hospital is taxpayer-supported and state-funded, not a company with profit motives and shareholder demands. Like other nonprofit, it pays no federal, state, or local taxes on the presumption it offers charity care, and the company benefits value at least as much as those breaks. And the Democratic governor oversees his board. The Democratic governor in his blackface or Klan getup. Yeah, isn't that great? Health system officials defended the institution's practices as legally required and necessary to generate positive operating income to invest in medical education, new facilities, research, and the latest technology. Yeah, new facilities where they can put a donor, some politician will say Mark Warner, seize money from the taxpayer to get his name, the Warner facility at the University of Virginia Health System. They pointed to the Virginia Debt Collection Act of 1988, which requires state agencies to aggressively collect money owed. Yeah, right. During the 6-year period studied, the health system had an estimated 6 million visits and care for those patients without regard to pay. Yeah, bull freaking crap, Swenson. For the vast majority of patients, we're able to agree upon a workable payment plans without filing a claim. Suing patients or using collection agencies are a last resort. Before patients got court summons, they would have received 4 or 5 bills over several months, along with instructions how to apply for financial assistance. During the most recent fiscal year, which ended in June 2019, the health system approved almost 10,000 applications for assistance under charity care guidelines set by the state. Most of those patients paid nothing beyond a $6 copay. In addition, the health system is undertaking comprehensive. We got somebody to join us here. Though there is no national data on hospital debt collection, the university pursuit of patients goes beyond that of a number of institutions. Johns Hopkins in Baltimore has sued roughly 240 patients a year on average since 2009. It averages more than 6,000 cases a year. UVA does. Well, still, Johns Hopkins kissed my butt too. Private nonprofit Yale New Haven files a lien only if a bill is over $10,000, and they can kiss my butt too. If the property is worth, and not only if the property is worth at least $300,000, do they put a lien on your property? So if you got a house over $300,000, they're going to put a lien on your property if you owe $12,000. Yeah, that's only the rich people. Well, if you live in New Maryland, everyone is DC area. Tenet Healthcare, a national for-profit chain whose stock trades on Wall Street, said it does not sue uninsured patients who are unemployed or lack significant assets other than their house. So they do not put a lien on theirs if they lack significant assets other than their home. So if, at least Tenet is saying if all the asset you have is your home, they're not going to sue you. But the nonprofits are better. Industry standard, all right, patients find themselves unable to pay for many reasons. They're uninsured or sometimes have short-term coverage that does not pay for treatment, or they're out of network, or have a high deductible plan. Increasingly, yeah, high deductible. I mean, I hate to say it, but I don't have, look, man, you should have a high deductible plan without question. Without question. You can find $6,000 to get your deductible met. You can. I mean, my goodness, you're gonna have, and then you just make terms. See, this is where I diverge from. Everyone's a victim. I say, look, you got to make terms with these people without question. You got to call them up, say, I can pay you $200 a month. I got no qualm with that. Or you just file bankruptcy. I frankly don't care. Whatever you got to do. These people, it's all political. So you're saying you're sticking to the hospital, and they're like, well, they're just going to raise the fees. Hell, dude, we don't know what the fees are to begin with. These guys are all scumbags. It's all. You is a big party, and you're not in it, my friend. So you got to take care of number one, which means if you want to say I got $7,000 bill with a stupid UVA Health system, you work out a payment arrangement. That's what we had to do. And it sucked. No other way around that. One of the best times of my life when we paid that last bill off. I'll tell you right now, we owed I think it's like $22,000. I think we're paying $250 a month or something like that. I can't remember. But anyway, we got that sucker paid. Hell, in like 2011, something like that. It was a long time. I mean, it was like 7 years we had to pay it off. But we got paid. And we worked out an arrangement with him. I didn't like it because I knew this other guy got wiped out. It pissed me off. Still does to this day. Still does to this day. But we worked an arrangement. Look, you got $6,000 as your deductible. You work an arrangement with him. I don't want to hear these guys are all victims. No. But if you need to go bankruptcy, hey, go bankruptcy. I don't care. I don't care. If that's, if you got $28,000 outstanding that you can't pay for these guys, you file bankruptcy and let them eat it. Oh, but Josh is going to raise the fees on all of us. Yeah, tell me where there's a market price system that we can see who pays what. There ain't. There's none. You okay? Patients also have trouble because, like many U.S. hospitals, the UVA system bills people lacking coverage at rates far higher than insurance companies pay. It's the freaking thing. It's such. Ugh. The $164,000 billed to Waldron for intestinal surgery was more than twice what a commercial insurance would have paid for her care. Charges on our bill included $2,000 for a 20. Okay, I'm just done with these people. But it's funny because my wife is on the UVA Facebook page, and they're saying, "Look what we're doing." They made no thing on this. And they're saying, "Look, we're helping poor people," because now we got this right here. The very next day, UVA promises changes after a report on medical debt collection. And they're touting themselves. We're not going to charge you, freaking scumbags. And who's this lady right here? Here's her. They have a pit. Yeah, right there. She's leaving as UVA's medical center CEO. President Jim Ryan told the employees in a letter that her departure was not related to bull crap. See, Sutton Walls, you know she's a political appointee. For whatever reason, she's political, and now she's leaving. It's no different than Katie Helinski over at the Cal Saver saying, it's a big party, my friends, and you ain't invited. I'm not invited either. And now UVA is going to promise changes. Freaking all scumbags. Look, man, if you get a freaking bill that you can't afford, go to bankruptcy. I got no qualm with that. None whatsoever. Talk to a bankruptcy attorney. Look, I don't know how it works. I've never been bankrupt. Go to bankruptcy. If you got a $6,000 deductible that you can't pay, you need to freaking work on an arrangement there. Don't go bankruptcy for that. You should have that. Look, you can pay $100 a month, $50 a month. Work on an arrangement. But if you got $73,000 because they're putting a freaking tube in you that normally costs $200 to $20 and they're charging $2,000, freaking write that sucker off. And just remember, Michelle Obama approves this message because she got $300,000 from a university, from a hospital in Chicago to be some kind of whatever, some make work job so they could have a Barack calling the shots for the hospital that gets state funding. Oh, yeah. So you're writing it off. It's coming out of Michelle's salary. Let's just say that. All right, this freaking infuriates me. Should infuriate you. But, of course, what's going to happen is we need more government. And the reason this is happening is because more government is what got us here to begin with. All right, we'll see you.